Doctor and Call comes to you compliments Hills and Valley Pharmacy and the Spice Isle Imaging Center. Good evening once again, and welcome to another edition of Doctor on Call. And this evening we have a very special guest with us, and of course we'll introduce her shortly. Of course, Dr. Nixon is with us as always, and we want to say a very special welcome to all our viewers on GBN Television, our friends on our Facebook page and YouTube channel, and of course our listeners on K105 FM. As we told you earlier, this evening we're looking at sickle cell disease, sickle cell anemia, and of course we'll go into some more details, and our guest this evening will share with us some first-hand information as it relates to her experiences having to live and take care of someone with that condition. So it is a good time to welcome our guests. We'll start with Dr. Nixon. Doc, good evening and welcome. It's a pleasure to be here again.
Good evening, and I want to show off my t-shirt, okay? My Sickle Cell Association of Grenada t-shirt. Good evening, everyone, and again, I'm thankful for the rain, except that, I don't think that I deserve water, despite the fact that I make big announcement that the whole thing is off, right? I have no water currently.
Did you open your tap? Or did you just think that you don't have water, so you didn't bother to open the tap?
No, man, I came when it was drizzling like oil. I thought I was in Saudi Arabia, but I go back and there's nothing, not even dribbling. But the rain is coming again, so I'm bearing a little patience and hope that I can survive. And I really feel sorry for people who have children and elderly, or people who really they need to have running water. And now that we have colds and gastro and all the rest, it's important that there is running water for hygienic purposes.
Yeah.
So still remember to boil your water, mothers, parents, everybody, and teach your children to wash their hands after using the bathroom. Right? Cover your nose. There's still COVID people. Okay, and there is a virus, a Sapo virus. Sapo means frog. I don't know how it comes to be there, but it's a Sapo virus, kind of cousin to the norovirus that we have every year that causes the flu. So we have to be very careful, and with the weather as it is, viruses tend to proliferate for some reason when the weather is like this. So please let's protect ourselves so we can enjoy. Now they have water to go out and play and come home and bathe and don't have to stay inside alone. But to go out and enjoy, other than that, the weather is nice. It's summer, it's sunny, it's hot, yes, but we still need to have water. Let's remember the hygiene. Boiling your water, covering your face, washing your hands, and don't be up in each other's face because there is COVID.
Yes, indeed. So let's welcome our very special guest this evening, Miss Shauna Williams. Miss Williams, good evening and welcome to the program. It's a pleasure to have you.
Good evening. Thank you. Glad to be here.
Right. And of course, we're looking forward to our discussion and all the information that you'll be sharing with us. So as we said, we're talking sickle cells. And Doc, let me just come back to you. It is something we've spoken about before, but of course, these are conditions that people live with every day. And yes, despite, the advances that have been made in dealing with it, it is still around. And so it's important to continue to share information so that people can be in a better position to deal and live with, sickle cells. So, Doc, let's start. Sickle cells. When we speak of sickle cells, just briefly describe for us what is it we're talking about.
So are we talking about sickle cell at all? I think is even more important. Sickle cell is a condition that you're born with. You either have it or you don't, right? It's a genetic condition that you're born, having acquired a gene from your mother or your father or from both. If you only have one gene, You may get it from your mother or father because they may have acquired that one gene from their mother or father. And if you have two genes, it means that you have gotten the gene from both parents. It means that if you have one gene, you're considered to have sickle cell trait, which is not as bad. If you have a gene from both parents, you have sickle cell full-blown disease, which is very challenging for our children and as we grow to adapt to a normal life. Why are we having Sickle Cell Awareness Week? Well, we're doing the week. Tomorrow's the 19th. Tomorrow's World Sickle Cell Awareness Day. And that's recognized by the World Health Organization, because there are just so many people in this world who carry the gene, whether it's as a single from a parent as a trait, or who have both genes and have full-blown disease, which can be quite debilitating, which requires special care, which requires a lot of support, and that's what's going to tell us how families can be affected by having to care for someone who has sickle cell disease. The World Health Organization's theme for this year's celebration is Hope Through Progress, Advancing Care Globally. And at a time when we are really pushing for patient zero. Patient zero is the first patient who's identified with whatever disease is around. And I'm going to say it as I say it every year, and with a lot of pride. A young man from Soches went to the US to study dentistry and did complete his study of dentistry at the young age of 32. On his way, in those days, there were no plane that take you to Boston in 4 hours, okay? So his weeks on the ship, and on his way to Boston, he became quite ill, right? And had breakout, he got cold, he just got ill, pneumonia, he just got very ill, but he had a wound on his leg. To have gone to study in those days, at the turn of the 18, a little bit, a lot, right? Because he died in 1912, right? He come from a landed family, but also remember that in that time, this is when you had segregation, racism was rampant, blah, blah, blah. Slavery had not yet been over very long. Because slavery in the US ended long after we ended our slavery, okay? Remember that. So this gentleman went on a ship up to the US, and by the time he got there, he was just really very ill. They thought it was just nutrition, like sailors would often get things like berry because they don't get fresh fruit and the vitamin B and blah, blah, blah. So gentleman gets better because he gets a lot of fruit and vegetables. Probably simply because the green vegetables had a lot of folic acid, which is one of the things we encourage our sickle cell patients to take so that they can build back up their cells. Goes to school, and every so often he gets ill. And as happened then, when we didn't have all the fancy things that we have now to figure out what's going on, they will take a drop of your blood and put it on a slide and look, and they saw that the cells, which normally look like a the red blood cell, right, doesn't have a nucleus but has like a flattened part. So it's almost like a pizza pie without cheese on it, with the middle flattened and the edges raised. That's what a red blood cell looks like, for simplicity. Recognize that his did not look round, that they looked more like a half moon, and that they kind of stuck on one another. So there was increased agglutination, as we say, right? So you had these cells, but they look like half moons, right? So they realized that this is something different. And from there, all research on sickle cell began. And having understood what this is, what's happened is that we were able to save millions of lives, change the quality of lives of millions of people. We know, for example, that India, which currently has a population of 9 billion, right? Oh, sorry, 1 point something billion, okay? 1.6, right? They're the country in the world that has the most cases of sickle cell. Plus, they have other things like thalassemia, etc. Other hemoglobin. Hemoglobin is that compound in your cell that carries oxygen, and that's what you kind of need to know. Hemoglobin carries oxygen. Hemoglobin carries oxygen, and it carries oxygen to all over your body, so to your brain, down to your feet, to your lung, to wherever it is. Hemoglobin carries oxygen. You want your cells, your red blood cells, to be very mobile. Remember us talking about anemia and talking how when you talk about diabetes, you talk about these red cells, how they're very pliable, like the man making pizza. Right. You want them to, those are the same red cells. No, if these cells are not round, they can't, and they're sticking onto each other. They can't move as freely. So, people with sickle cell trait or disease, worse yet, does not have that same capacity to transport oxygen, for oxygen to be transported throughout the body. And we'll talk a little later about the conditions that we see. So you have these hardened cells. It means that they can't easily squeeze through the blood vessels. They're abnormal in shape, right? It's not like they're round, so they can roll around themselves and stuff. They half moon, and then they're sticking onto each other. So obviously, they sometimes when they get to very small vessels, they can block these vessels because you have almost like a little clot down in these very, very, very small spaces. So we want to thank Walter Clement Noel for allowing himself to be a subject at a time when there were no rules. There were no rules that directed, that regulated how research was done. And being a black subject, I don't know how much blood was taken, I don't know what, but Walter Clement Noel was the first subject to be researched. And we were thankful to him for his contribution, without knowing it, to the well-being of people who carry this gene. 1 in 10 persons in Grenada actually carry the sickle cell gene. Not everybody has sickle cell, right? Most people have just a sickle cell trait. But that's kind of, world is probably like 1 in 15. We think 1 in 10 in Grenada, from the tests that we've been doing, right, may carry the sickle cell gene, right? And mostly the trait. We do have a lot of people with sickle cell disease, but from our tests we've been doing, 1 in 10. And that's a lot of people. There's a lot of people to care for, a lot of people to support, a lot of people to educate, a lot of people to ensure that they have good health practices, proper nutrition, enough exercise, maintain hydration, all the stuff that is required for sickle cell people to be well. So, World Sickle Cell Day, hope through progress, advancing care globally.
Right.
Okay, so you can only advance care if you started somewhere. You can only advance something that's already started. So thanks to Walter Clement Noel, we have contributed as a nation, and should continue to contribute towards advancing the care of our people with sickle cell disease, and disease in particular, since it's so difficult to contain.
Let's talk a little bit quickly about the symptoms. So it is believed that it may show up at around 6 months of age in a child or baby. What are some of the symptoms? What do you look for? What would a doctor see, or what would a parent, for example, notice that would probably give cause to lift an eyebrow and start asking questions?
So there are a couple of things I want us to go back to before, because you don't want this sickle cell thing to just jump on you, okay? Not in this time. This is a time of advancement in medicine. What we in Grenada, what should happen, because it is normal. That is why we encourage our women to have proper antenatal care. You may not know whether or not you carry the sickle cell gene, but all women have a sickle cell test done during pregnancy. We still don't want women to turn up to deliver. If you haven't had a baby before, don't turn up for delivery. Try and go through the antenatal process, the prenatal process, so things like sickle cell can be identified. If a mother is identified with sickle cell, the father of the child is supposed to be tested as well to see what are the possible outcomes. However, in Grenada currently, all babies are tested at birth for sickle cell. Okay? If you found positive, we make sure we figure out whether you just have the trait or you have the full-blown disease. So there shouldn't be much of a surprise. Okay? You do also have fetal cells. You have cells that sickle, but you have normal fetal cells. When in the uterus, the hemoglobin, yes, fetal hemoglobin is that of the fetus. It changes by 6 months, and that is why at 6 months you have all of these things showing up. Okay, so we look for the possibilities at birth, right? But certainly the clinical symptoms may show up by 6 months. However, if you know, you will be prepared, and you'll take precautions to ensure minimization as much as possible of our children, or that person who has sickle cell. I'm going to talk about sickle cell disease mostly tonight, as that which really affects our well-being. You would want to minimize the symptoms and ensure the best quality of life for the person who has disease. So, yes, you show up. What do you show up? You would show up in a child who doesn't know, who is not known. The child may develop a full-blown pneumonia. Okay, the child may develop. I hope Godfrey isn't lost.
No, I'm here.
Are you lost, Godfrey?
No, I'm here. Mm-hmm.
I lost it from my screen. The child may have fevers, fail to thrive, because remember, oxygen, the hemoglobin carries oxygen around, and tissues, even though the food is there, they need oxygen for to grow and to do your functions. As a child grows, you would find that the child doesn't thrive as well as his companions. He's smaller. He might have longer bones, because red blood cells are made in the bone marrow, right?
Yes, yeah.
So your body tries to compensate by making sure that you have more bones, longer bones to put it, but that doesn't help very much. So you notice a very thin child, a child who's always anemic, a child who gets sick very often, and whose head is kind of elongated, right? Because even the skull is growing, it grows to ensure that it also contributes to the making of more blood cells. But anemia is the following, or what we call low blood count is probably the heralding and the most common symptoms in children like that. Of course, followed by the failure to thrive.
Right. We've also heard about swelling of different parts of the body, like the hand and the feet, and so. What about those?
Yeah. So those things are really due to you can remember I tell you those cells tend to stick together. So sometimes you can have blood vessels that get clogged and all the rest of it, and you have all the swelling of the hands and the feet, and it's painful swelling of the hands and the feet, right? And sometimes even the joints, they get a lot of pain and swelling, right? So you had a picture of a child. Did you see that picture? There's a very classic picture with a baby with his hands very swollen.
Yes, I think we do. I think we may have that, and our master controller should be able to share that image with us. Yeah, in fact, I think it's probably image number 4 where you have that that kind of swelling. So our master controller should be able to share that.
So it's warm, tender. The child doesn't want to move his limbs. That kind of swelling of the limb, and you notice this end where you have the smaller blood vessels that become clogged by these red cells that coalesce, form little clots in the blood vessels. However, we have to consider what could be some of the worst other symptoms, and that is for everybody. Okay, everybody who has sickle cell. Some of the worst symptoms, probably the most difficult, is to look at your child having chest pains. So apart from the usual joint pains that they get, having chest pains, which can be very dangerous, because what you can have is a clot-like syndrome that occurs in their lung, right? And that can cause the demise of the person. Okay, it's called sequestration syndrome. So what you have is all these red blood cells come together, these abnormally shaped red blood cells come together and clog up the lung and can cause the death of the person. So that is one of the things. But our children can also, even children can have strokes and heart attacks. which is the same mechanism. You have a clot in your lung, you have a clot in your brain, you have a clot in your heart, right? So you can have those kind of problems. You can have kidney problems because all of those organs that normally require that oxygen is taken to them can have clots occurring because they have very, very small vessels. You can have loss of vision and all the rest of it that comes. So it's very important that we diagnose early. So we can take precautions to ensure that the children do not have symptoms or do not have severe illness, that we can educate parents as to how to identify changes in the children's well-being and when to start moving. Don't wait until a child has been had fever for 3 and 4 days to go to the hospital, because it may mean we lost a little boy last week. Condolences to his family. It must be very difficult for them losing their little child. So may he rest in peace. But it's also for us to learn a lesson that we still need to figure out what's going on with our children and to find yourself where the help is, to understand, which is Sickle Cell Association really provides for that. The Sickle Cell Association of Grenada has clinics, and we can talk about it a little after, but we will talk about the clinics. There are clinics available where they get special care because their needs are a little different from other children. So, and parents need a space, and then they can identify with other children, and parents can identify with each other and offer the support that they require in order to keep their children as well as possible.
Okay, wonderful. So, Doc, I want to bring in Miss Williams here at this point, and I'm glad we just spoke about some of the symptoms. Miss Williams, again, we're really happy to have you, and you're willing to share with us information. Let's talk about your experiences about having to take care of someone with sickle cell.
Wow, it's very challenging because the thing is, having a sickle cell crisis, it just creeps up on you. It's like you don't have any time to figure out anything. So it's like 1 minute he would be all good, and then the next minute you start to have a lot of joint pains, like just like that, like instantly, without even any warning. So, and then sometimes with all the pain, he starts to have fever and all of that. So from all these years that I've been taking care of him, when that usually starts, I take him to the emergency room as soon as possible. So he can be hydrated and get the proper care, because at home, there's so much you can do in terms of just giving him the regular ibuprofen. But if he goes to the emergency room, then they can take care of him as they can, as they should.
Right.
Rather than myself. Yeah.
When did you first identify, the child being a sickler?
He was diagnosed when he was 2 years old.
2 years,
He started having joint pains on his wrist. Usually it would be on his wrist, like swollen wrist. And then afterwards it was going on to his foot, swelling of that. Yes, that's what I found out.
Okay.
So he would have been born in a time, how old is he, 11, right, Ms. Williams?
Yes.
He would have been born in a time when we were not doing screening at birth.
Yes.
So there are children who don't know if they're born and were rechecked at 6 months. But he would have been born before that time.
Yes.
I guess it was a big shock for you.
It was, trust me, it was. And I didn't even, knowing the fact that I didn't know, because I don't, but when I was pregnant, I did a sickle cell screen and I didn't have any sickle cell. So knowing the fact that I found out he had the sickle cell trait, it was a shock to me. And his father didn't even know he had a trait. So that in itself was a shock.
Right. So Doc, hence the reason why. Yes.
So the Sickle Cell Association of Grenada has been going around to almost every health fair, right, as far as we can, and screening. I think for the first 6 months of this year, we've screened. We've had 269 people who have come forward for screening, right? Now, I don't remember the exact number, but we have seen people with sickle cell. We have seen the trait and a couple with disease. But it's important, especially that our men know. It's also important, that in other countries, in bigger jurisdictions, Like in Massachusetts, for example, people have to do premarital counseling, and all of these things have to be taken into consideration and discussed, right? So that we can figure out, we're not telling people not to get married, we're just saying if you get married and you have children, here is a possibility. What are the risks that your children will have either sickle cell disease or sickle cell trait? Just so that you know, so you can make plans, you don't have surprises. And you can choose whether you want to continue a union anyway, if you're going to have some serious outcome for your children. So it is important that I think it's this is my opinion. I think it's very important that all men try to get screened as far as possible, so that they can say to their female partners, okay, so you're pregnant, I have sickle cell trait, or I have sickle cell I have sickle cell disease, full-blown disease, right? Disease you will know because you would look a little different. Remember, they look slimmer, they're thin, they look, you can see they're having challenges. Sometimes the tummy is a little big because the spleen grows because it has to destroy all these cells. Whereas most people's red blood cells last for 90 to 120 days. In the case of the patient with sickle cell, you break down cells every 30 days. So try to imagine. It's very hard to keep up, right, with providing new cells. And yet your spleen, which is the breakdown factory, has to work overtime to get rid of all these cells that are breaking down and stuff. That's the reason why some of the sickle patients join this, okay?
Right.
Right. So the spleen can become very, very enlarged.
Right. Ms. Williams, I'm sticking with you for a bit. In terms of daily care, because of course you would want to do everything in your power to ensure, although you may not be able to control it, but to prevent an episode, because the pain can be really, really, really bad and excruciating from what I've learned.
Yes, it is.
Let's talk a little bit about the daily routine, how you care for him in terms of his diet and all of that, just so that you minimize as much as possible some of the complications.
Right. So he takes folic acid every day. He usually eats his vegetables, his red meats, all the things that you could. He stays hydrated. He's taking a medication called hydroxyurea right now. The hydroxyurea minimizes the crisis.
Right.
Because
it hydroxyurea prevents the sticking together.
Yes. So with that being said, he's not sick as how he used to sick like frequently as before. Yes, I think that's about it.
Right. Doc, this is interesting. Just hearing us say that he's not sick as he used to be. When you spoke of patient Zero, he died in his 30s, yeah? 32. And we know that there was a period in time when sicklers did not go past their 30s. Now we have sicklers into their 70s and possibly more.
I'll tell you better. I just diagnosed last year, I think 2 people. I met a woman who was probably just early 60s, who had 4 children, which we often ask people not to, who have sickle cell, not to become pregnant, simply because when you're pregnant, your body makes more red cells, okay? So you have an increased risk of having clots, because you have all these cells that agglutinate, right? So pregnancy is a period when you would have a lot more blood cells. So if you have a lot more, you have a lot more to clump together and form clots. So you can have strokes because it clots the brain, or you can have heart attacks, you can have sequestration syndrome in the chest, and all the rest. So that is why we ask people not, even in the US where they have advanced medicine, it becomes very difficult even to deliver a baby by anesthesia, by C-section, because there are just so many variants of challenges that's going to occur. We tell our patients, make sure you take your medications. Miss Williams mentioned that her son takes hydroxyurea, right? We want to make sure that they have as little crises as possible. Do I want my son with sickle cell to play? Of course. I want him to be like Messi playing football. I want to be messy about it, right? But I also want him to know that you're a little different, right? I want him to know that you have to hydrate yourself, because when you get dehydrated, you have more cells, apparently, more cells and less body fluid. So it comes out to thicken. So at greater risk for having crises. And they will start having crises once they become dehydrated. Or they go to the clinic regularly, right? And the children are informed as to what this is and how to relate to their well-being and how their nutrition should be. And then, of course, they're at greater risk for having pneumonia. So they're given the pneumonia vaccine yearly to prevent having pneumonias. So there are things that we do to ensure that frequency of disease of symptoms is minimized, right? And that's why we have to work with patients. You have to know what your child's condition is. You have to know what you need to do, right? It is very important that we push for nutrition. Green leafy vegetables to get this folic acid, because we don't give iron to people with sickle cell for a set of reasons. But we need to ensure that their body can provide by proper nutrition, enough proteins and folic acid to help to build up that heme complex. All right, so patients are very informed as to what it is. You see, Miss Williams, you don't see her crying. It's your smiling cheese because she can't control that. No,
yes, you can tell.
I how pretty she is. And she grinning because I'm sure it must have been quite a tragedy for you when you first discovered your son constantly being sick at 2-year-old. She was run up and down, and even when they have a cold, and here's your child who can't move because he's just having so much pain. Me and Godfrey.
No. Our pain is old age pain.
Imagine your 2-year-old child doesn't want to play because he's having so much pain. Yes. So that's it's important that we know.
Doc, I want to talk a little bit about some. We in passing we didn't mention about strokes and so neurological complications. We also know of complications, blindness, and skin ulcers. I know the skin ulcers, it's a common one. Miss Williams, have you experienced that with your son?
What is it, man?
Skin ulcers, the sores and so on.
Ulcers on the ankle.
No, I have not.
Okay. Doc, there's a...
that is more common. That is actually more common in people with SS, okay, who have full-blown sickle cell disease. Having the ulcers is more common. But sometimes... I was telling you, I discovered a man who was 65 and been having these mild pains. And I sent him to do his thing. And he actually had full-blown sickle cell disease. But this is a guy who worked up in the hills in one of the country parishes, of the more rural parishes. Work hard, work as a laborer. He has his farm and he worked hard. Okay, he doesn't do work like me. You're sitting in an office, no AC, right? And he discovered in the last year, discovered that he had full-blown sickle cell disease. So while people may manifest it differently, the truth is that most people with sickle cell disease have a hard time if they're not informed as to how to care for themselves. Or if the parents are not informed how to care for them.
Right.
You were asking me about the wounds, about the ulcers. Which in Grenada we call sore foot, okay? You get a wound on your, and it's simply because you don't have proper circulation, right? You have all these very, remember, the further you get from your heart, the smaller the blood vessel go. The smaller the blood vessels become, right? If these blood vessels become so small, so it means that there's not a lot of oxygenation, right? Not much oxygen gets to the skin. And remember when we talked about diabetes, we talked how the further it is, the smaller the vessel. Not only do the vessels disappear, so even the little pulse you would have had from the heart, right? But then it just has spaces like when you drop water on the sand. Remember we talked about that? Similarly, there is no blood vessels. What happens is that you don't have oxygen getting in there. You touch the skin and it breaks. If it breaks down, it's very difficult to takes a long time, right, for healing, because there's so little oxygenation of the area to enhance healing and make tissue regrowth. That is where the ulcers come. And some people, that's the first thing they see, that they have an ulcer. I had another patient, she was retired. That lady was close to 70. And she came for something, for her high blood pressure or something. I was living in another jurisdiction. And she came, and I said, "What happened to your uncle?" She said, "I don't know." Right? But every so often a little sore will come and go away. And she had to self-treat, but she was in her late 60s. She had never had any children, so she was never diagnosed. But you really want to know all of these things, because think about the quality of life you may have lived had you known what this is about.
Right, excellent. No, I want to in adults, we know that the complications are also there, but I want to speak to our men folk and the importance. And there's a condition called priapism. Let's talk a little bit about that, Doc.
So I want to speak to it in a very serious way.
It is.
So priapism, in order for a man to have an erection, he has to have blood flow into the penis.
Yes.
And then the channels that get locked off, right? In the case of people with sickle cell, yes, you have the
so the blood flows in, yes,
but it doesn't flow back out. You may have all these little clots that just block up the passages. So you may have priapism, and priapism is that's what it's called when you can't get rid of an erection. Okay, and priapism can be a surgical emergency. They will give you a certain time, but after a while, you don't want the tissue that's beyond the base of the penis to start breaking down, right? Because that oxygen is used out. So they might have to cut the vein at the back of the penis in order to have the urine, flow back, right? So that is one of the complications in men. And again, that is why it's so important to maintain your hydration and keep your hemoglobin up and all the rest of it. That is why it's so important that you know your status. And that is why I'm asking all men. I had a patient that I've seen in the emergency room, again, as I work in another jurisdiction, with priapism, who would come in, and sometime with a muscle relaxant, it will go away, right? But not everybody's so lucky. And he knew that if this didn't come back, right? If this didn't go down, I'm in trouble. So he'd come to the ER. He had, within a certain time, he'd make sure he gets there, because we knew that with some muscle relaxants, he could go to sleep and it will go down, right? And of course, the anxiety alone may make it difficult for you to not have a reversal of this erection. Right? But it also means that a partner who has sickle cell disease, who may have priapism as a complication, requires a supportive environment. A partner or family, a male must have a family who understands that this is something that would happen, because men will have normal erections, right? They should have an erection when you wake up in the morning, right? And you expect that to reverse after a certain time. And you should have an erection to have intercourse, and that should go back after a certain time. So we need to have an environment that is respectful and understanding and educated and supportive, right, and compassionate, to understand that this is a big thing and not something to laugh at, and something that we need to. And everybody, this is no laughing.
No, it's a serious, it's a very, very serious.
It's a very serious thing, because sometimes when they do the surgery, you are not able to get an erection again.
Yes.
So that's one of the challenges. So that people need to be educated, both the victim, right, the person who has the disease, and the people who surround him. Okay. Alright?
Yeah. So, Doc, let me ask, and maybe Miss Williams could come in here as well. In terms of the crisis, and Miss Williams did say sometimes you don't even know, it just comes on. Doc, is there any way to sort of walk around that? Maybe there might be signs or little thing before, little signals that can probably indicate that there's a possible crisis that may come on. Anything you've observed, Miss Williams, over the years that can sort of point you in that direction? Yeah.
Sometimes the weather, let's say when rain falls or something, when outside is like really really hot, even if he drinks a lot of water as he should, no matter what he does, it's still, the crisis still comes on. Sometimes it's hard. It's very hard. Me for myself, like after all this time, sometimes I'm like, oh wow. It's like I don't know. I don't even know how to answer.
You don't know what to expect.
Yeah, exactly.
And you're there, wishing that you would know so that you can take the action immediately to prevent it.
Exactly. But the thing is with me, I always have medication there for him.
Right.
So from the moment he starts to feel like he said, "Mommy, I think I have pain, or I have pain here and there," I'm like, instantly I just get the medication to give him. I always have medications there for him. So that's the only thing is, sometimes with the severity of the pain, the medication that I'm giving him it doesn't do anything. Hence the reason why most times I would take him to the emergency room as soon as he start to get the pain.
Right.
And I think to segue here to one of the serious problems that we have in relation to our adult sicklers in particular, and their dependence on narcotic substances. So one of the things that your threshold for pain may grow. That's kind of normal for human beings. So it could continue a little higher and higher. Sometimes patients require addictive substances, narcotic substances like morphine, that kind of thing, pethidine. They're all cousins, okay? To ease the pain from the crisis. So yes, you can give IV fluids to improve the volume, but there still is pain. There is a major challenge, and it is the responsibility of the physicians, right? Because those are drugs that are highly controlled. So you cannot go to the hospital and just get a pethidine injection. To get a pethidine injection out of the cupboard, the doctor has to order it. The nurse goes into the cupboard with another nurse. She counts what's there, right? She takes one. She says who it goes to. She signs. The person who's accompanying her countersigns, right? And the doctor writes that he's given. And then nurse says how much is left. And when her shift is over, she says, "Well, Godfrey came in and he needed a pethidine, right? That is the level of control. We had 12 when we came on, because the nurse who came on will hand over those drugs, right? Well, they have to do a handover of what is in that cupboard. And then when she's handing over to the next one, she says, "Well, here it is. We gave one to Dr. X. Here it is written in the patient's notes." And it's highly accountable. But some patients become addicted, and it requires a couple of things. It requires, first of all, families and people who have sickle cell understanding how this thing goes, right? Why you have pain. It requires them understanding, how can I prevent my pain? It requires them understand that you can use regular medications in the beginning. Don't wait too late when the pain becomes excruciating. And yes, some people have excruciating pain in the beginning, but that's not the majority, right? It requires explaining to patients why you give them these substances, why you feel obligated to give them these substances, right? And to explain to them the addictive nature, okay? Explain to them the addictive nature of these drugs, so that prevention, taking your hydroxyurea regularly as is prescribed, so you don't have agglutination sticking up, that coalescing of red blood cells that can cause the arteries to be blocked, and the lack of oxygen beyond causes pain. all of the things. So education is very important to prevent this very, very important complication, because we have known of people who have died as a result of overdose of these medications. They literally become addicted to the drug. So not necessarily because they have pain, but because they're now addicts to these narcotic substances. So we have to practice responsible care of our patients. We have to ensure that we can teach our parents from early, and so it's very important that our children are diagnosed from birth, so that there's a behavior in families that mothers understand, even single mothers understand. What do I do best to make sure that my child does not have a painful crisis? And how do I teach my child to understand what this is, to identify when it's coming on, so we can work together? How I make sure he drink his water when he goes to school, that teacher knows that this is happening, that you're out on a date with your boyfriend, he knows that, why you look so, you don't look very well today, come, you need to drink. Why you shouldn't drink alcohol, because it's going to dehydrate you, blah, blah, blah. Why you shouldn't expose yourself, especially like now that it's so hot, just too much sun. Why you need to get your stuff so you don't get a pneumonia. Why you get your hydroxyurea so that you don't get the big S syndrome, which I tell you, I've seen patients die as a result of hypertension. So there's a lot of education that goes on. And my favorite thing, pastor uses the same Bible every week, he still have to talk about what's in the Bible. So we have to, that's why we have clinics. We have clinics for children. We have 2 clinics per month, one in St. Andrew at the hospital and one in St. George's. I can't remember the exact days, but I know we can find out. There's a number that we can call, which I will get for you shortly, right, to ensure that patients can visit. Right?
So the one in St. George is the last Thursday of every month.
Okay.
So the last Thursday in the afternoon is up at the hospital, right?
No, it's in the health center.
In the health center, St. George's Health Center.
Yes.
Yeah, and I know parents sometimes get a little tired, but when you consider what you're preventing your child from having, it's very important. And then there's one in Grenville for children. Hip hip hooray, because as of June 5th, the adult clinic started, okay? As of June 5th, the adult clinic started, and I'll tell you when these clinics are. So, in the general hospital, in the outpatient clinic, that's where the private block used to be. Down as you go down towards the main hospital, at 1 o'clock, on the third Wednesdays, there is a clinic. You call the hospital number and they'll put you onto the extension, right, for the clinic. So we're going to ask our adults, because they have not had care, because sickle cell people really just need they need extra special support, okay, to prevent the discomfort. And that's so the third Wednesday of every month, there's a clinic at a general hospital, and the first Friday is at Princess Alice, and both clinics are at 1 o'clock. This is for adults. I'm going to ask, if you're an adult and you think you have been diagnosed with sickle cell, especially sickle cell disease, please contact the clinics, right? Call the hospital, and St. George's Hospital is 440-2051, and ask them to put you on to where you can register to go to the sickle cell clinic. And Princess Alice Hospital is 442-7251, and again, tell them to put you onto the extension where you can be seen in the sickle cell clinic. Right. It's a good time to join the sickle cell clinic, because guess what? It's a good time to join the sickle cell clinic, because guess what? There's nobody in the adult clinic yet, so kind of put your foot in there first. So nurses can get accustomed. And we have some nurses who are very dedicated, and some doctors from the public service who have been really dedicated. Occasionally there are clinics in Carriacou. Hopefully we can develop a regular clinic for Carriacou, but that's in the making. Our triumph for this year is that we've had the adult clinic with the help of the medical department of the hospital, of St. George's Hospital, Ministry of Health, to develop these adult clinics. And of course, mothers like Miss Williams know that she takes her son every month or whenever he has a scheduled visit to the hospital to be seen by nurses who are very, very dedicated and who know exactly what to look for in a sickle.
Right, Doc. I wanted to talk a bit more about the treatment of sickle cell. We did speak about some of the medication that can be used, and so we've also heard that maybe in young children you can do a bone marrow transplant. Let's talk about that. Is it
maybe you can, but so there's a new thing, a new mechanism, a new procedure, but I don't know that that's going to become available to us very soon. So remember, all blood cells are developed in the marrow of the bone.
Right.
If you can get rid of that and put somebody else's blood cells in there, it will go from that. Like it's almost like placing stem cells into there. So you get a match, and could be a cousin, your brother, whoever it is that matches you, and they implant it. But they have to kill off all the blood cells, all the blood cells first. That's not an easy thing to ask a child to go through. Okay.
Right.
Not only do we not have the technology here to do that, right? And support a child, we don't have that kind of pediatric, especially since most of the people with challenges are children, severe challenges, right? That's where you see sick earlier. Yes, you do have other people, but you can do a bone marrow ablation and do a bone marrow transplant, but it calls for finding donors, blah blah blah. It's not a simple program, so that's not something that I will tell people to put your pot on fire. There's another new therapy that costs like $1 million US. Okay, so we're not even going to go there yet because we're not ready. This is really just new therapy from the last year. However, other things are important. Apart from the general hygiene practice of drinking water, getting your pneumococcal vaccine annually is very important, okay, to prevent you having pneumonias. Because on top of having pneumonia, you can have all these clots in your lungs from sequestration, which can cause death. Folic acid does help in development of cells, and hydroxyurea, like we said in the beginning, helps to prevent the agglutination of the red blood cells so that our patients remain well.
Right, wonderful.
So those are kind of the hallmarks, and you encourage, nutrition is very important. Lots of green leafy vegetables, fruit. You need a little sunshine. You need to play because you still want the kids to be strong, but a lot of fluids, a lot of hydration.
Right, yeah. I was going to ask you about the diet, and you briefly mentioned, but there seems to be a multidisciplinary approach to, caring for people with sickle cell. Of course, in addition to your medication, iron. What about?
We don't give iron. We don't give iron.
Sorry, iron free. Sorry, iron free. Yes.
Yeah.
What about blood transfusions? Periodic blood transfusions
Sometimes
can
they
help.
tell me if you become very anemic, if your blood count goes under 6, you will get a transfusion. But we try to avoid all of that because as much as we screen for blood, we can't know that there are other things that are not in the people's.
Right.
So, for example, we're talking about people having changes in. You get an organ.
Yeah.
You get behaviors from the people, right?
Yeah.
Yeah.
So try to imagine you behaving like me, or me behaving like you. Lord have mercy, right? But seriously, we want to inject, to put into a human being as little of another person as possible. And that's why those basic hygiene practices are so very important. Drinking fluids, eating well, green leafy vegetables, lots of fruits, right? Eating, make sure you have proteins that help to build up the hemoglobin and all the rest of it, okay? Because people are saying, oh, why don't we get something to out it? You can't change it. It's just like being born male or female. it is genetic. It's encoded in your being. So you can't, up to now, we don't, well, unless you get those expensive intervention, right? Up to now, we don't know how to make you not have sickle cell as part of your being, because it comes written in your genes, right? So that's the challenge.
Can someone, let's say for example, I'm born normal. Throughout the course of my life, can I develop sickle cell?
You mean if I can get sickle cell?
Yeah.
No.
You can't.
No, you're born with that tendency.
Okay. Okay.
All right.
So
the way you're born is where you remain.
Born
you don't
free.
Have it, you
That's
don't
it.
Get it. As free as the blood flows.
Let me ask this, and I'm just thinking out here. And we mentioned blood transfusion earlier. If someone, let's say a normal person goes to, maybe they have an accident and goes to the hospital, they needed to get blood, and for some reason they happen to get blood of someone who's a sickler, can that person?
That's not going to happen, because before you become a blood donor, you're screened for all of that.
Okay.
Trust me, if you have sickle cell, you don't have enough blood to give to nobody, okay? So
okay.
You can't be, you're unlikely to be a donor.
Right.
Right?
Even if you don't know that you, if you have just a trait.
You are screened. The blood bank is very, very, very particular about what is in your blood.
Okay.
So there's a cadre of people who are donors who are perfectly screened, and even when they go back to give, they're habitual donors who, when they go back to donate blood, are checked. What is your hemoglobin? So if your hemoglobin is under a certain amount, right, you can't donate. If your hemoglobin is under 12, you cannot donate blood. It won't fall down in the place. A pint of blood is 1/6 of all the blood in your body. So if you give up all of that, your hemoglobin will definitely drop by at least probably 10%. Just as how it goes up when you get 1 unit of blood. So sicklers are not accepted as donors.
Okay. So that won't happen, right?
It shouldn't happen, because it probably happens in other crazy places, but in our system it is unlikely to happen. And in systems where you have good ethical practices, it should not happen.
I like that. I like that statement. Ms. Williams, as someone who've experienced this, you live with this. What would you say to other parents who probably in a similar situation? Because you seem to be able to deal with it over time. I guess you've been able to deal with it well, and your son is doing pretty well from what we've heard. What would you advise them? What are some of the key advice you would give to them?
So hydration. That is one of the main input, one of the main things. Always stay hydrated. Always take your medication, your folic acid. Well, I'm not sure if most kids would be taking the hydroxyurea. All your vegetables, your fruits, all those things. Yes, exercise, but not too excessive of exercise, that kind of thing. And always, I don't know, I try my best. And always make sure you go to the doctor, regular. Always, check. Don't matter, even if you find nothing wrong, but always make sure on doctor's appointments. Always go to the sickle cell clinic. At least that in itself would help you.
As an individual to deal with it.
Yes, definitely. Because sometimes, even as with your family, sometimes your family alone cannot give you the help that you need in terms of medical wise. Right. So you need assistance. You need the assistance.
What about school and so? The teachers, are they familiar? So in case, for example, he gets a crisis probably while in school, what they need to do, other than contacting you immediately?
Yes, so he has a letter in the school from the Sickle Cell Clinic Association stating, he has the trait and whatever. So they are aware of his condition. So whenever he gets, well, so what I tend to do, each class that he goes to, even if he has a letter in the school, I talk to one-on-one with the teacher, let them know about his condition, because even if the letter in the school, sometimes the teacher still doesn't even know unless you tell them. So I usually have a good rapport with each teacher that each class that he goes to. So whenever he's sick, I let them know. If he's sick at school, they would call me, and so it goes. Sometimes he's hospitalized. What they would do, they would send the work for me, and we would work hand in hand. So I must say, I give props to the teachers in terms of handling when my son is not there. And the thing about it with him as well, he picks up very well in school.
Right.
He's excellent at his academics. So kudos to him. Trust me, I'm very proud of him.
That's wonderful. That's wonderful indeed.
Yes.
Remember also that teachers would rather that you tell them the challenge that your child has.
Exactly.
That they don't want any surprises. They're not physicians. They're not nurses. They don't want your child who has a chronic disease that has a need to be monitored, and they want to understand as well. Okay, so you want to sit, and I applaud Ms. Williams that you go and you have a informal discussion with teacher, and you educate her so she can give your child what he requires, and it becomes easier for her as well, so she understands. You should see him a little droop in the class. Hey, Tommy, what's going on here? Are you having a pain? Would you like something? Would you like your pain medication? Why don't you get a little extra water? Were you playing a lot in the schoolyard today? Those things. Did you drink your required amount of water and all the rest of it? So at least teacher becomes educated, and she might also identify a child who has a similar problem. If the mother with a child with a disease, she may be able to identify other children who have the problem, who are not as closely monitored.
The thing is, you had mentioned. Sorry, Godfrey. Dr. Nixon, you had mentioned in terms of, sometimes you might see a child and you can tell that they're a sickler. My son, if you see him, you would not tell that he has a sickle cell trait. Okay. So you have to let them know that he has sickle cell, because like I said, if you see him, you will not know that he has sickle cell. Okay. So, and then the thing about it is, as you mentioned in the school, sometimes he would stand what we call, when they have assembly, and he says sometimes by standing for too long, he kind of feels a bit dizzy. So I usually tell him, whenever that happens, just let the teacher know. So he said he would do it, and then the teacher would tell him to sit, that kind of thing. That helps a lot.
That's excellent. Yes. Let me ask you again, Miss Williams, in terms of the episodes, whenever he gets an episode, how long does these episodes last?
It depends. There are times it lasts maybe about a week. It depends on, yes, a week. With that being said, with the week, sometimes he has to be hospitalized because of the severity of the pain. Because I have mentioned earlier, sometimes just giving him the pain meds alone would not help him. Right. So with that, you have to be hospitalized to get fluids and just monitor him and see, if there isn't any infection, any fever, because sometimes all of that come into play when they have a crisis. So it has a lot. Sometimes it goes, well, the faster I get him to the emergency room, that's when the faster I would get
the shorter stay.
Yes,
exactly.
Best results. So,
yes. So the faster you know, when you realize, okay, it's a crisis, you bring them to the emergency room instantly, and they would get the help that they need. Because the longer you stay at home, and you find, okay, well, you're going to continue giving them the ibuprofen and giving them fluids, that alone in itself would not help. Trust me.
Okay, Doc, she mentioned sometimes it can last up to about a week. That's a long time, and we're talking here about this clumping of blood cells, in the vessels. Talk me through that. I'm kind of having a little difficulty here understanding how this can happen for, a week. That's a difficult thing to have to go through.
Sometimes the crisis is related to infections, especially respiratory tract infections. Okay, and sometimes you just have so many so much clumping that even given fluid, you can't give too much fluid at a time. It has to be done slowly, right? Doesn't move on and open those circulatory passages as rapidly. So you have to, take your time, because you can't just take a gallon of water and push into a child.
Right, of course.
Okay, it takes a little time, but you want to declump those cells, and it takes time. Okay, it takes time to do all of that. So that's part of the challenge.
Okay.
Right?
And so, Ms. Williams, one more question. In terms of the frequency of the episodes, what have you observed? So he gets one now. When again?
Well, for him, he usually, before the hydroxyurea, every 3 to 4 months he would have an episode. As he started to take that hydroxyurea, it would be more like every 6 months.
Okay.
It would happen.
And is the intensity of the crisis any less since hydroxyurea?
Yes, it is.
Right. So we see that agglutination, that clumping of red cells is mostly the culprit in the initiation of the pain. And if you could prevent that, right, and how the hydroxyurea really helps these unfortunate sufferers with sickle cell, especially full-blown disease. Interesting, because her son has SF, right?
Yeah.
And F is fetal hemoglobin, so his fetal cells are still there. You need to have big people cells at after 6 months. You get big people cells, which are kind of normal, but he has kept his fetal cells, and that's why he's still. In other words, basically what he have is 50% of the cells, less than 50%, because he have sickle cells, and then he have all these baby cells. So he's right. He seems to have. That's why he has a crisis. Because generally, people who have AS can slide through life. They keep the water and stuff, and it's a little easier. But he behaves like a sickler because he really just does not have a lot of cells that have matured.
Okay, wonderful indeed. Doc, let's go. Our telephone line is going, so let's go to the telephone and engage our caller. Doctor and call, good evening.
Good evening.
Yes, good evening, caller. Yeah.
Yes, good evening to all.
Good evening.
If you have, to the doc, if you have sickle cell and you have diabetes where your arteries are compromised, where are you going from there, doc? Give me a little explanation as to how dangerous that situation is. Thank you very much.
Thank you very much, caller. Thank you.
Well, it's like, we have a thing we say, ingredient, more weight on queen sugar. It is obviously you have two diseases that behave similarly. Right, in relation to compromise. So your risk for heart attacks is increased. Your risk for kidney failure is increased. Your risk for having a stroke is increased. Your risk for having pneumonias is increased. Your risk for, did I say stroke? Your risk for visual loss is increased, right? And of course, your risk for limb loss is increased. Fortunately, like I said, the people we can screen for both diabetes and hypertension and sickle cell. Fortunately, we teach our children, like Ms. Williams teaches her son, how to mitigate the challenges, to prevent, to lessen the possibility of the challenges that sickle cell disease brings. Fortunately, so knowledge is power. Right? So you now have two diseases that behave similarly on a certain level to control, and know that your risk of having those complicated things, because children can get stroke too, and I wasn't talking about stroke for old people. I'm talking about little children having stroke because these clumps get into their brain, right? Clog an artery, and the tissue beyond that dies. So children can also have strokes and blindness. Okay, so once you already have one risk factor, one disease that can increase the risk of you having those complications, when you have a second one, your risk is, I guess, multiplied. So either way, proper control of your disorder is in order.
Okay, Doc, another question to you, and maybe Miss Williams could coming after. In terms of the episode, so the pain and so caused by the clumping, do they occur anywhere, anytime, or there are specific parts of the body where it's most prominent?
So, like I said, the chest is the worst.
Chest is the worst. Okay.
The chest, yeah, it's called acute chest syndrome and can be fatal because you get these large clots, these large clots in your lungs, right? It's very, very painful. So once your child starts having chest pains, you head for the emergency room. Or even an adult with sickle cell, you have to head for the emergency room. The joints. The hands and the feet, and the hands and the feet and the joints. Those are where those pain occurs.
Right.
Those pains occur. Right. Head. You can get headaches. You can get eye pain because you have pain. Right. But usually joints, and with swelling and redness if you have a thrombosis, if you have a blood vessels that are clogged and everything's just red and beyond.
Right. Ms. Williams, the pains and so in your son, where have they been most prominent?
Well, currently it would be, as Dr. Nixon said, it would be the joints and headache.
Joints and headache. Okay.
Most partly with him. Okay. Joint pains and headache.
Okay, wonderful indeed. So our telephone line is open, folks. The number 435-2041. You can give us a call if you have any questions or anything you want to share with us. We'll be more than happy to engage you. So the number again, 435-2041.
Is it Marine?
No, go ahead. Yeah.
So I want to raise a very important point. So Miss Edwards' son, who I'm going to call Tommy for his own protection. So Tommy is in a family where obviously she spends a lot of time educating and supporting him. The truth is that there are a lot of people who have sickle cell disease who don't get that quality of support, whose families are not necessarily wealthy or well off or able to provide this stuff. So we have to take into consideration the social component, the emotional component of a child who is always in pain, who has crisis very often, who's hospitalized and isolated from his parents, people who are unable to work because, they already have damage to their joints, they have chronic ulcers, they're isolated from society. So I'm calling for people to understand that, we need to practice compassion and understanding and support for people, because sometimes people will isolate you because you have a sore foot. And I'm saying this in the saddest way possible, right? Without understanding that this is something you have no control over, and you go to clinic as often as you can. And sometimes some people have had these ulcers, which is what we call sore foot, right? Some have had these ulcers for so long that the only thing that will fix it is to get a graft, a skin transplant, where they take skin from another place and put it on. But if you're already having challenges with just circulation generally, try to imagine getting some other skin that has its own inherent challenges with circulation. So I want us to be compassionate and supportive. I want us to understand that although we don't see sickle cell people out there, we think there are people who require help, who require support, who require a lot of emotional support. Go figure, if your 6-year-old child was in pain every week, or have to go to the hospital at least once a term and spend 2-3 weeks there. It's not simple, because not all children respond very, very, very well to the medications and stuff. The majority will, but try and understand, okay? You may see a kid having to walk to school and he hop in because his ankle hurts, and some of us drive past and we wouldn't offer a drop, right? Try and understand. I think I'm asking Ghanaians to be understanding and compassionate and supportive, especially from an emotional and psychological standpoint. And where possible, when you have a young adult, 24, 25, who doesn't no longer is cared for by his parents. He may have need for having a home, having a stable home with basic amenities. Somewhere is clean and healthy, and there's running water, and he can. And it's not too hot, so that in the night when he closes his window, he don't feel like he's going to suffocate and dead. Those things, that he always has access to food. If he can't work because he always in crisis, who takes care of him?
Yeah.
He has the need for support from the society. And so I'm just going to ask us as citizens of this country to understand. First of all, there's 1 in 10 of us that has the gene, and there's a lot of us who, not 1 in 10, maybe a little less, but a lot of us who have the disease and require support. So please try and be understanding, because sometimes we ask for donations so we can provide food and stuff for people, children, and support. If you have a mother who has a child who is always having pain and so you can't go work, you're going to go to work. How are you going to go to work? Okay, you're going to need to get some support from the community, and sometimes the social support that we receive, the safety nets that we have within the government service, it's just not necessary enough to help to deliver all that the patient requires.
Right. Okay.
And the other thing is, I'm going to ask people to be fast. Whenever you see a health fair, go look for the Sickle Cell Association, especially men. I'm begging the men, right, to just go. If they come to your boys' school, please get permission, because sometimes we go to schools and try to do screening among the boys, because like I said, boys at a certain age have not been screened. We hopefully we're able to find a way for there to be continuous screening of newborns, so that way we know our status from birth, right? At least by the 6th month, when the hemoglobin changes over. And I'm going to ask all men to make sure that when you pass by a health fair, I know there's one at Foodland next week. No, tomorrow. Tomorrow's the 19th? Yeah.
Yes,
there's one
tomorrow's
at
the 19th,
Foodland,
yes.
and Sickle Cell Association will be there at Foodland on Kirani James. But Foodland in town is having one next week, the 26th. I know there's also a screening. There's a health fair in Bolio at the school. At Volio 2. I want to talk a little more about that, but those are opportunities. So wherever you see a health fair, if you have not been screened for sickle cell, just go. They will screen. The Sickle Cell Association actually tries to raise funds. So we'll take a contribution, but to make sure that we can screen as many Grenadians as possible to figure out how much this disease penetrates our community, and in order to be able to provide care in a preventative or prophylactic way, right, even for adults, so that people's quality of life is okay.
Right, wonderful indeed. Miss Williams, anything else you'd like to add? We're getting close to wrap up time. We're almost at the end. Anything you would like to add here in closing?
Well, not really. I mean, Dr. Nixon said everything that I wanted to say, so.
Yes, indeed. Well, of course, we want to thank you very much for appearing and coming and share with us. And I'm sure people out there who probably have similar experience, they'd be happy to know that there are things that can be done to help minimize, because it's not a nice thing to have your son or daughter in pain and you just have to look on, and sometimes there isn't really much you can do. So I'm really happy and I'm thankful that you accepted the invitation and came on the program here with us tonight.
Yeah, Doc, and I hope your son is an advocate, because I think it's good when he can teach his friends what is this all about, because the message has to be pervasive. It has to be all over the place. Since we're the pioneers, we should be able to talk about sickle cell like how we talk about Julie Mango.
True.
Yes, indeed. So, Doc, maybe your final word on the Sickle Cell Association, and we'll wrap.
So the Sickle Cell Association is the flagship for sickle cell, of support for people with sickle cell disease. We support early screening, neonatal screening. We try to penetrate the community as fast as possible so that people could understand that this is a disease that we are pioneers in the person of Walter Clement Noel, whom will be arrested tomorrow, I think. We'll be laying a wreath. He lies at the Soteres, at a Catholic cemetery, almost as you enter. So I'm going to ask people, even without sickle cell, just go and see the history that we have as far as health goes. It's very important, especially now when research is so very important. You have to have evidence-based practices to come up with conclusions as to how we manage disease. So again, we want to thank him, and we hope that he will receive the national recognition that he deserves as a pioneer in research and in disease management. We really are pushing for that and hope that the people of Grenada will support us as we ask that Walter Clement Noel be recognized as a Grenadian icon when it comes to disease management, and something that we can't change, because if you have it, you already got it. Let's not just remember sickle cell awareness just during the week of sickle cell awareness, or on Sickle Cell Awareness Day. It must be something that must always be in our minds. Okay? And again, I want to emphasize that our men should get checked so we can figure out how much is there. Women get checked when they go to have a baby anyway. So, but the men maybe will not be checked. So I'm going to ask our men to just come forward with a little bit of blood, and you'll get, we'll take your name and send you a report, so you'll know whether or not you have sickle cell. Remember that if you have it, you got it forever. Okay? It's like being a boy or girl or having nice hair like Godfrey. Can't change it. All right, what it is, it is. Right, whatever it is, it doesn't change. It's a genetic disorder. It comes encoded. It's already written in your DNA. So if you have sickle cell, you have it. You may have the trait, or you may have a full-blown disease. Mm-hmm. There are people who have full-blown disease that don't show the symptoms. Okay, and there are people with trait who behave like they have the full-blown disease. That is their clinical picture. They're only patients, right? Your individual manifestation of a condition is your manifestation. Again, support families. If mothers, if you have children, please come to the clinic. Please take them to the clinic. Adults, if you have sickle cell, please join the clinics. I was trying to get a number. There's a number that we have for the Sickle Cell Association if you want to get information, which I can't find yet. Please, you make use of the clinics so that you can get even more support from the government. Our nurses are volunteers, and they're there every day, and I really want to thank Nurse Jenny and Nurse Allison, Jenny Batiste and Allison Clouden, who are retired nurses who give their service every time there's a clinic, right? And give it with love and a lot of joy. They really want to do this with a lot of passion. And there are other volunteers. I also encourage people who want to be parents who have children with sickle cell, and other people, whether or not you have sickle cell, to become a member of the Sickle Cell Association, because we really do a lot of work in the community. I just have small membership fee, like $20, just to cover stuff. We meet every third Monday. So far, we're meeting online, but there's been a lot of development. We have a lot of people who work with us, right? And sickle cell must be, like I said, as easy as talking about Julie Mango. Right. I have 2 minutes. I have a minute.
Yes.
For advertisement.
Yes, go ahead. Sure.
Yeah. And I'm going to take poetic license as usual. So on Saturday, again, the Sickle Cell Association will be there, but the Bolio Combined Northerners Sports Club is having a hash. Everybody knows what a hash is, right? You walk all over the place and you drink. You go and eat food and drink rum afterwards. I could never understand that, but it's really a time for interaction. From Bolio School in the afternoon, but we are going to have a health fair in the morning from 10 o'clock to 2 o'clock. The hash starts at 2. It includes an intervention by the Sports Council and the importance of exercise and being active in community. So they'll be there to give us some guidance. We're going to be screening for diabetes and hypertension as usual. Cancer Society will talk about cancers and prevention. We're not going to do any screening. Food and Nutrition Council should be there with us. Sickle Cell Association, of course, our dentists are going to talk about, and that's one of the things we should have talked about too, Miss Williams, about the importance of dental care.
Yes,
you know, you want to talk about that quickly?
Well, you just go ahead.
Just as how, remember, your teeth need proper circulation, okay, to stay healthy. If you don't control your thing and you have constant clotting, like constant blocking of your arteries, the same with the arteries from the teeth, from the oral cavity, and all the structures in there are going to be lacking oxygen, and tooth loss and decay is kind of expected. So our people with sickle cell also need to Denise, can you tell me that number again, please? Also need to have dental care, so they must go to the our children have free dental care in the public system, and if you start our children early, the earlier you start, the more you're likely to preserve the teeth. So dental care is very, very important. We're going to have the dentist, we're going to be talking about vaccines, and we're going to talk about stress management at this thing as well. And we are likely to be doing eye screen, I say. Eye screening of the eyes, not ice cream. It's screening of the eyes and the visuality. And we will talk about managing stress. This is a very hard time, especially in the light of our increase in crime. It's a very difficult time for people. There are lots of economic challenges. So we're going to talk about how we manage stress and where it comes from. So that's one thing. The other thing is that we spoke about having a cancer portal several months ago. Basically, a platform, internet platform where you can go on and find everything you want about cancer. Tomorrow there will be a webinar about men and cancer, right, on this Caribbean Cancer Portal. I've put it on my Facebook page. I've sent it around to people on WhatsApp and stuff. It has been widely published. I've told at least 200 people in Grenada, and I've asked them to publish it. Please encourage our men to look at this, because they asked for this. They asked for, this outlook on cancers in men. Our men tend to not be as motivated as women in seeking health care, especially screening for disease and cancer. The number one killer of men in cancer is prostate cancer, and that can be controlled if we diagnose early. We still don't know everything that causes you to have prostate cancer, but remember also men can have breast cancer. We've seen an increase in stomach, large bowel cancer, lung cancer, and it's kind of difficult because our young people are starting to smoke tobacco again, and because our children are starting to do vape. I have Challenge, which has nicotine, one of the most addictive substances that we know. Our children are going to segue into using tobacco, where there is not only nicotine, but there are also a lot of toxins that can cause cancers. So if we can get on to that tomorrow evening, I can probably send it for you, Godfrey.
You already did.
We can.
You already
I
did.
can send it for you.
I got it already. You sent it before.
Can you put it on anything on GBN?
Yeah.
So that people can see the thing, and you need to register so you can get access to the Zoom. If you don't register, you're not going to get access to the Zoom.
Okay. Mm-hmm.
It comes through SGU, and sometimes it's a little. If you're not registered, SGU will not share the Zoom platform with you. So please, I'm going to ask Grenada, since we know that cancers are a number one cause of death among us. Mm-hmm. So that's it.
Yeah.
And of course, like I said, remember to boil your water. Right, wash your hands, cover your face, wear your mask if you think, because there's a lot of viruses, and of course COVID is still around. Yes. Wash your fruits. I saw a video today that has been circulating, came out of Jamaica, of a rat eating a ripe mango. Yes, we always say that the burjuk one is the sweetest one, but sometimes it's not a burjuk. Sometimes a rat bitten, and that would give us leptospirosis that is going to kill us because we're going to be unsuspecting. So please, parents, ask your children not to eat mangoes that are bitten, and make sure that all fruits that we eat are washed.
Okay, well, thank you very much, Doc. Thank you very much, Miss Williams. It was indeed a pleasure having you, and we're looking forward to having you again, Doc. Until next week, we're going to have another discussion, and of course, we have now started a new initiative where we'll be promoting our programs and topics well in advance. So we'll be talking tomorrow about it, and so folks can know well in advance what we'll be discussing, so they can prepare their questions and all of that to be part of the program. Yeah, remember, folks, it's information that we're sharing with you. Doc cannot diagnose you on the phone. You can visit her at her office. She's at the Esplanade Mall, close to the Grenlec building, first floor. That's where she is, so you can go there.
No, I'm on the third. I'm on the second floor.
Second floor.
Yes, Grenlec is on the ground floor.
Ground floor, first floor, and then second floor. So yes, Doc is on the second floor. You can use the elevator, or you can, take the stairs for a little exercise. That would be a good thing. So you can visit her, get a full diagnosis, so you know exactly what is happening, and that way you would be in good hands. But she can just share information here. She cannot diagnose you on the phone. So go visit her at her office at the Esplanade Mall.
Godfrey, sorry. The number for the Sickle Cell Association, 407-6399. 407-6399. 407-6399.
Yes.
If you want to call to make an appointment for the clinic, want to call for when we're having a meeting, if you want to call for when whatever you want to get some information about the Sickle Cell Association, about services, about, want to get somebody, if somebody has a problem, whatever, please, 407-6399.
Yeah. So thank you very much, everyone. Thank you for your questions, and thank you for staying with us until next week. Do enjoy the rest of the evening. Have a good night. All the best.
Thank you, Ms. Williams. A pleasure working with you.
Doctor and Call was brought to you with the kind compliments of Hills and Valley Pharmacy and the Spice Isle Imaging Center.